Joining me on today's episode of the Anthro Education Podcast is Dr. Kurt Schütte. Kurt is a PhD in biomedical sciences with a specificity in biomechanics, and he is the creator and CEO of RunEasy, which is a gait analysis technology and software that I've been utilizing myself for, I would say, over the past 6 to 8 months now, in the clinic with a variety of athletes and really digging the technology. And Kurt's a wealth of knowledge. We get into a lot of topics, but this podcast in particular touches on 3 of the biggest misconceptions when it comes to gait analysis. And who better to explain it than a guy that has a PhD in biomechanics and developed gait analysis technology. So without further ado, Kurt Schütte. All right, joining me on today's episode is, do you go by doctor or do you just go by Kurt Schütte? Because I know you're a PhD, so I don't know how that's handled non-stateside. So I'll let you, should I address you as doctor?
You can, but just say PhD specifically. Okay. It's I'm not doctor, I'm like, the research doctor.
And the CEO. So as you heard in the bio, Kurt is also the CEO of RunEasy and one of, if not the main developers of the tech there. So first of all, thank you so much for being on the show today.
Yeah, thanks, Boris. It's a really nice opportunity. Really enjoy chatting about this and looking forward to brainstorming and chatting more about the running gait.
So before we dive into all the technical whiz-bang fun stuff, give me I don't know, it doesn't have to be that brief, but give me a background on like, how'd you get into biomechanics? How'd you get into running? And then why did you end up developing RunEasy?
Yeah, sure. It actually started back when I was an intern in physical therapy. And I think, first of all, I got passionate about more the orthopedic stuff and then more about the chronic rehabilitation and how the nature of running injuries is specifically can come back, out of nowhere. It's very, the onset is very difficult to understand sometimes. And I found that I just got super curious about how biomechanics and how gait analysis plays a role in injury development. And, back then we were always looking at ways in which we can try and investigate and how we look at look at using our naked eye, how we can analyze running gait. And I guess the passion just started there, and understanding how and why forces travel through our body, and understanding what is the cause and effect between modifiable biomechanical factors and how these are playing a role in either developing an injury or preventing. And that took me through to my research, where I got kind of pulled into the research because I realized that there was a lot of gaps in our knowledge. And to a certain extent, we've learned a lot in the industry. We know how to make good assumptions and estimations about how running gait can be linked to certain types of forces and injuries. But I could really identify that there were a lot of gaps in the knowledge, and that's where my science pulled me into the research side of it. What's happening? Why are we getting injuries? And the hot topic at the time was barefoot running and how changing your foot strike pattern based on your running foot strike, based on how there's a kind of a relationship or interaction between your footwear and your running style and injuries. And that kind of got me into the biomechanics even further. And took me to conferences, and I got to present at the ACSM Congress in Indianapolis, and amongst some of the top experts in the field, and just grew the biomechanics passion from there to an extent where we realized that there's also a missing component when it comes to practical tools that we could use in the field. And it doesn't always help to have to send your athletes and your patients to a sophisticated research lab to get a full comprehensive analysis if you really want to know what all the details are going on. And we really wanted to close that gap. And that's where the idea of RunEasy came along, and building a wearable technology that you can get that same biomechanical, or to a certain extent, a really good overview of biomechanics in the practice or outside on the track, where your athletes are actually training, where they're getting those injuries. So yeah.
Yeah, and I will attest to this. So I stumbled across Run Easy on social media, and I actually, kind of reached out. So I was the instigator of this whole thing, but I have been looking for, running assessment technology. When I went to chiropractic school, Optigate had given some technology to Logan College where I went, and so I got to use that. And then I was looking at everything from GPS based drones to follow people with, just different, so we could get them in a natural setting, because we know that there are differences, treadmill versus non-treadmill, just based on what they're used to, not just the differences in the treadmill.
Yeah.
But I'll, give you kudos to you and your team that, you guys have basically packaged like as best as we can, because there have been other run monitors that go on shoes and things like that, but basically package a force plate into something that's worn on the athlete that you can wear both in clinic and outside of clinic, which is the amazing part. The remote, send them out for a run, collect the data, download it when you get back. And we've been using it quite a bit here, and it's there's two things I really like: the tech by itself, but also the ease of use of parameters. You don't get overwhelmed with data, right? There's 4 main metrics, and now there's going to be a new metric. So for those that are the uninitiated, can you just go over the 4 metrics real quick, and then maybe talk a little bit about the new one that's coming up?
Yeah, sure. So the 4 primary metrics that we look at is firstly impact loading. And we're looking at now impact in terms of how the shock is being absorbed by the legs. So it's the magnitude of the impact shock. And we also look at the time components of the impact. So that's the second metric. So it's how long that impact is being absorbed from the moment your foot strikes the ground. It could be a heel strike, mid-foot strike, forefoot strike, until it reaches your pelvis. And so that time element really gives another dimension to impact absorption. How quickly, how actively are you absorbing that impact? And then we also look at a compensatory metric. So we know the pelvis plays a big responsibility in aligning the body in terms of also absorbing shock, but also in terms of control, coordination. And we look at a dynamic instability metric, which we researched during my PhD, and we found that it really indicates a lot about how you are relating to fatigue, you're compensating. And so that's the third one, is dynamic instability. And the fourth one is, we know it's more spatial temporal. Well, fourth and fifth is like it's ground contact time. We know that how long each foot is on the ground, and we combine that spatial temporal information with running cadence, which is an often used metric to modify a running gait to see how that will affect your forces and injuries. So those are the fourth and fifth kind of coupled together. And we're really excited because we're going to bring out a global running quality score, which basically aggregates all of these metrics into ones, and also looks at not just the absolute measures, so like how high your impact is or how quickly your impact is being absorbed, but also taking into account these asymmetries between the left and the right leg, and summarizing it into one score that you have between a 0 and 100, so that you can really identify your overall quality. And at a quick glance, you can know, okay, has my overall quality improved or not? And if it has changed, why? Like, where's the weak link? And if you have a weak link, what can we do about it? So yeah, that's a brief summary of what we're measuring. It's not a lot, but we really distilled from a lot of kinematic and a lot of kinetic data. We funneled it down into what, first of all, was relevant, and second of all, what was validated, that we could actually get reliable results from the lab. And thirdly, that it's meaningful. You can apply it in clinical practice in some way. Yeah.
Well, and for somebody that I teach, a big component of what I teach is running gait analysis. So, like you said, looking at people with kind of this penumbra, right? That you're looking at the general quality of a runner is actually, in my opinion, probably about all you can pick out with your naked eye. Right? It's like the general quality. You literally will get fooled. I mean, I can't tell you how many times I've watched somebody run and then you take them to slow-mo and you're like, oh, that's not what I saw at all. And then even when you take it to slow-mo, you have parallax of the cameras, you're in 2D instead of 3D, and like it's not the same. So again, it's really good to have just bare bones metrics that as a clinician you can use, but then also fairly easy to communicate to the patient or the athlete. And then even easier, as you said, maybe not a pure objective measure, but the run quality score gives them a gauge of which way are things going, right? Better, worse, over time, with, from season to season. If I have a, high school runner that's going cross country, indoor, outdoor, things are going to change. And sometimes, I would imagine that we may not always see things change for the better. And that's actually normal. I mean, if you're going to be a 3-season runner, like, and maybe we set up parameters for like, we just don't want to see it go this low, or if it gets, to this, red lines over here or something, we're going to pay attention to that. So just something to add on that is more, as you said, validated and objective, instead of just looking at somebody run. Or what's even worse is the subjective input of the runner of, yeah, I'm feeling okay, XYZ. We just know that's, that changes hour to hour, day to day, for sure. You had mentioned a couple key things that you have taken into the data pool for Runeasy, but that get talked about a lot in running gait analysis and just running overall. If you open up Runner's World, you're going to read about, cadence and symmetry, and maybe not often talked about is impact, in like the layperson, but from, you and I's perspective, impact, I mean, for a long time, it's just been talked about as like the bane of injuries. So we thought it would be a good idea today to just kind of like tackle these based from your input, from the data you've gathered from, professional experience, your PhD thesis, working on Runeasy. So the first one we want to tackle is the concept of perfect symmetry. Obviously you're looking at symmetry, right? You're looking at coronal plane shift, you're looking at, impact magnitude, left, right, things like that. So first of all, what should we expect in terms of normalized symmetry in those 4 metrics?
Yeah. So I think the whole concept of symmetry is the whole concept, however you want to shape it, is super interesting in how we go about making clinical decisions based on a threshold, you could say. We're always searching for a comfortable threshold of what's good and what's bad. And there's a couple elements to this that I'd like to discuss, and that we came up, found through our research, and as well as, through testing, hundreds of athletes. And the first is, we typically, if you're looking at, we often like to draw conclusions based on things that we already have tested, or asymmetries that we feel comfortable with, like a strength asymmetry of 10% is what we strive for. Nothing more than that. Rule of thumbs, right? And first of all, what we realized was that, when we aggregated all our healthy data, so we took away all the, injured or symptomatic runners, that you can have a very high, you could say very high, you can have quite high asymmetries that are asymptomatic. In other words, there's not necessarily a problem or an injury, but that 0% that we always try, like perfect symmetry we're trying to get between, bilateral, between left and right limbs, is maybe, is something that is a bit of a, not a myth, but it's something we should not necessarily strive for, because there can be a certain degree of healthy asymmetry that not necessarily represents an injury. And what we've done is we've per each metric that we measure, we actually have its own data-driven benchmarks. In other words, we aggregated all those hundreds of runners together, and we found that you can have a healthy range, or a typical normal range of asymmetry can go beyond 10%, even in terms of a zone, rather than just a defined threshold. And yes, we zone these into green and yellow and orange and red, but it can go up to 10, 12%, 13% in certain metrics, and it's firstly it's data driven, and secondly, it's not just looking at a specific threshold. It's being able to kind of gauge where on the continuum you are in, and where each individual kind of what's the wiggle room for each individual runner or athlete.
Well, and can you discuss real quick when it's, I don't know how much of this can be pulled directly from the data, right? This has to be history and all these things, but kind of explore the concept of, well, do we see more asymmetry based on dominance, right? That they're going to favor a side that's a better option, or offloading due to injury or weakness? Have you guys picked up any central theme there?
Yeah, yeah, excellent point. Excellent point. So there you have, you have just first of all, if you look at asymmetry, you can say, well, what is the asymmetry percentage as a score? But the direction of the asymmetry is something really, really interesting and not so straightforward, like you mentioned. Sometimes what we notice is that it depends on the compensation strategy and the injury that the runner has or coming back from. Like you said, unloading is a typical type of asymmetry where you have lower impact, for example, on the side where there's an injury. And we kind of link that more to a protective avoidance gait pattern, where it could be, and often it's subconscious. And that's the interesting part about it, is that it can happen. And we had a young middle distance athlete where he went out for a run, and after about 20, 30 minutes, he started feeling pain in his calf muscles. He was starting to get, a bit of a strain going on. And what we could see immediately from that point was that there was a shift from impact off of that. That's the side of where the calf was there. And he was not even aware of it, but he was subconsciously, unloading that leg, a compensation pattern, which you could say is natural compensation. It's good to see, like, the body is smart enough to be able to figure out that stuff. But if it persists, and this is what we see, is that the persistent overloading of the healthy leg can result in a new overuse injury. So that's where you can get the overload injuries coming, the Achilles tendinopathies, the shin splints, the patellofemoral pain. And then when you look at the asymmetry score, you can't just look at it at face value. You really have to understand the history of that athlete and be like, okay, how many previous injuries have you had? Because you could be offloading or overloading depending on where those injuries, or which side of the injuries are coming from.
Well, and we've all heard, that previous injuries are the greatest predictor of future injuries, and it's not the same, locale. It's just because of this. And it's obviously, it's kind of, you got 52 cards in a deck, 52 ways to represent, compensation and offloading, unloading. But one of the cool things that you kind of breezed over there about Runeasy is the fact that, like, this is, and maybe I just don't know, the first thing that I've seen where we can send somebody out on a run or put them on a treadmill for an extended period of time and actually see that kind of neuromuscular efficiency breakdown, which you and I have talked a little bit about how that correlates to other things like, aerobic capacity or VO2 max. But that's where I get really interested, because how many times have you heard a runner in the clinical setting say, it's always at mile 5, or it's, when I hit a 60-mile volume week, that's when stuff starts to fall apart. And now you can actually track that rather than just being like guessing, well, what's happened at mile 5? Well, we have a massive, impact magnitude goes through the roof on the right and things like that. So I think it's very cool to have over time versus just put them on the treadmill, which, again, people will fake their gait. They'll make it try, be as perfect as possible. We're not usually going to have somebody run for an hour or two in the clinic for a variety of reasons. So there's it's a Swiss Army knife of, gait assessment in the clinic, because I can have somebody go out and run for as long as I want and, say, well, I'll look at the data later. I don't even have to, go over it with them right then if I don't want to. So symmetry, we're kind of, whatever we want to call these misconceptions. I wouldn't say but misconceptions that symmetry may not be what we're seeking, but if it goes too far outside the bounds of normal, then we have to explore, well, what is the compensation at hand, right? So we still have some clinical detective work to do based on the data, right? So the next one, which I would say is probably the most popular thing to talk about of running coaches and runners, and you see it represented in like Garmin data and stuff like that, is cadence, right? That we've seen all this stuff about optimal cadences and how shifting cadence can be a directive of changing gait or, changing impact. So let's go through this one a little more step by step. Is there, from your data, in your study, is there an ideal cadence? Because this is something we hear all the time, that there's an ideal cadence just overall. So is that a myth or misconception, or is there an ideal cadence?
Yeah, I think the concept of ideal cadence, I think, is true. I think definitely there's an ideal cadence. It's about what is the ideal cadence for you and for me and for each individual, rather than this, general catch-all, like kind of one-size-fits-all approach of everybody should increase their cadence by 5% or 10%. Or first of all, everyone should increase it, and everybody should increase it by an X amount. What we see through the data is that everybody responds differently to they respond differently to increasing or changing their cadence. And there are good studies, really good studies that have shown that majority of people do reduce their impact with higher cadence. But what we also see, what we don't see from those studies is the individual responses. So we get to see like the mean standard deviation and the changes. But if you were to maybe plot each individual, you might see that some people responded really positively, some people not at all, maybe some even slightly negatively or negatively responded to it. And what we see with Run-EZ is that because you're able to test so quickly how someone would respond, so you would go, use your preferred cadence, not use a slightly higher cadence and a slightly lower cadence. The first time it came up, we actually thought like, hey, is this an anomaly of some sort? How can some people, or a certain person, actually have no change in their impact when they increase the cadence, or some people really increase their impact. And that's when we started realizing like, yeah, it comes down to testing each individual's response. And there's some things we can take from the literature, as that we try to simplify and use in practice as easy as possible. But we also see that some things need to be tested, and cadence is a really nice example. If you were to read any blog post from Runner's World to any book, and the common denominator is like change your cadence, increase your cadence, and you'll reduce your impact and you'll reduce your injury. But we have a tool that measures the output of that, the impact, and yeah, we see that it's not the case. Not everybody responds positively. So that begs the question: are we doing our best in practice by, suggesting the same cue to everybody, or should we be a little bit more objective in our thinking, or more experimental in our approach to find out what is working best for each individual, rather than go by a gross assumption to some regard.
And I'm obviously a running nerd, so I follow a lot of prolific coaches via social media and stuff, and you'll see a lot of dogmatic approaches where there's just an idealized like 170 beats per minute for cadence, and then you'll see a bunch of approaches to get athletes within that realm. And like you said, it's kind of an N=1 approach, which we don't want to say that you have to approach every patient as an individual, but then you still kind of get this generalized view of like, yeah, sometimes we do want to change things. But like you said, there's anthropomorphic kind of measures we need to take into account: people's running history, how fast they're running, how fast they're in. All these things change, and we see. I've heard, I'm big into trail running. I've heard professional ultra runners. I remember Jeff Browning in a podcast saying, well, all my injuries changed when I started really focusing on my cadence. And it's like, so then people will hear that and think, well, cadence is the thing. Well, then again, if we tested Jeff Browning, maybe we see that things changed because of his cadence, right? It's not just that cadence is magical. It's what it shifts within the, maybe it changes symmetry. Maybe, by shortening his stride and upping his cadence, all of a sudden he becomes more symmetrical. There's less impact. All these things occur, and we need to think like second and third order instead of cadence fix all. Because again, we just want people to use things that are efficient. Maybe it's benign. Maybe if we up our cadence, there's less negative and only positive, and it's just become something that reduces efficiency. I don't know. We have mentioned impact like 15 times due to symmetry, due to cadence.
Yeah.
So this is really the biggest thing I wanted to dive into today. You guys have a measure of impact magnitude. We're looking at ground contact time, which has always been highly, I don't know if correlated or associated is the word in the data of like what we're looking for with ground contact time. But first of all, for a long time in the literature, it was increased impact, increased prevalence of injuries. Is that still the case? Is that what the evidence is telling us right now?
Yeah, and that's great question. I think there's mixed evidence. There's definitely mixed evidence, and again, it's the conclusion. It depends on how you look at it. I think there's a couple of different factors here, and in a general note, we say higher impact equal higher injuries, but more from when you look at it from a cumulative loading perspective, right? So you can measure your total training loads if you want to. The traditional way is through mileage and through your distance and how many miles are you clocking up every week, and how well are you at building that chronic load up versus acute spikes in the load. And often we use that mileage as the way to identify training or chronic loads. But it's, if you and I were to run next to each other, I would say if you break it down to impact per step, and if we were to run side by side and go for a 10-mile run, same speed at the end of the run, we would accumulate every impact from all the steps. Then I would even have the same cadence. And I had, maybe a 20 or 30% higher impact per step. Then my cumulative loads are also going to be, a lot higher. And that's where measuring the impact on the body rather than just using a general mileage load is something that we say, okay, well, that's where the injuries can develop. But it's not just the magnitude of impact that's important, because you can also tolerate a certain amount of impact depending on your load tolerance. And it's that balance between how much load is on the body versus what your body is able to tolerate is the big question. And we're measuring external load. And so that's why you need to be able to link it to how are you able to tolerate that load. And to a certain extent, what we're measuring, because it's an impact measure on the pelvis, and it's a response to how you're landing and how impact is being traveled, and by the time it reaches your pelvis, it's a center of mass. It is also has an element of load tolerance to it, but you have to look at that balance between load and load tolerance. And obviously, when you exceed that, I think the risk of injury is much higher when your tolerance is lower than the load that you're bearing. But what we came across is it's not just the magnitude that's important. It's how quickly that impact is being absorbed, which is telling you a lot of information. That impact duration.
Well, let's dive into that for a second, because you and I have talked about this a little bit previously, but another, along with cadence, the other thing that we'll see is these cues like run soft, run quiet, it's like all hands on deck to reduce impact, or what we would, facsimile for impact, right? Like hearing somebody being loud, or, them complaining of certain things like shin splints and stuff like that, saying, oh, this is an impact-based injury. But like you said, it's, I think you use the word tolerate, but I would also say kind of, I really like the fact that you're saying, well, there's this chronic, impact load. They've used that in European Soccer League as a standard for how much, volume they're getting over a week, right? They're going to look at this stuff and be like, hey, this player, they did the same amount of work, or same amount of time, but there's more impact. He's actually done sooner. So he's done this week. So there's a chronic load that you're using as a parameter for training, which I love, versus just, volume or time or whatever. But then that ability to attenuate impact is a big deal, because we need to harness, ground reaction forces to actually propel us forward. So kind of dive into the topic of how it can hinder versus help if somebody just goes after reducing impact, versus how we use the ground to propel us. Like, how do we suss that out where we're not just making somebody worse by trying to reduce impact?
Yeah, indeed. And that's where we come across with this impact duration metric, which is like how you dampen it and how you are able to reuse that energy in a sense. And what we see, we work with a range of runners, on Olympic level in Belgium down to recreational, and we see that the runners that are at going towards Olympic level are able to flatten the curve, and we use that post the pandemic kind of analogy, dampening the curve, flattening the curve. It's not just about the magnitude; it's about how you're able to delay that impact to a point where you're able to reuse that energy and or you reuse that impact to propel you as well. And we believe that there's a strong link there between load, like the load duration, so how quickly that load is absorbed, and the ability to use that load to propel yourself forward. And that's why it's not just looking at how big the load is, but how quickly can you or how quickly is that impact being absorbed, and can you delay it long enough that you can actually reuse that in a positive effect. And the exact mechanisms behind that is something we're still researching and still figuring out, but it's something that we're onto, and I think it's a really interesting ability to be able to measure it and see how it differs between different runners.
Well, and whether it's right or wrong, what I've kind of started leaning towards, which I've always been more of the lean, being a rehab professional, that if I want to get somebody out of the mindset of, maybe they were coached like, hey, I just got to run quiet. And maybe it has helped them. They're like, man, this really helps reduce my Achilles, tendinopathy symptoms. What I always kind of tell them is that just because your Achilles hurt or doesn't hurt anymore doesn't mean that you're a more efficient runner. So then we could say, well, what are some of the variables that help you reduce impact? It's everything from generalized strength to efficient biomechanics to muscular coordination or motor control. That's all we're working on in a rehab setting, right? Or all these things. So it comes back to, some people are they have higher kinesthetic awareness and better motor control, so they're going to be a better runner, right? So their mechanics are cleaner, they can generate force better. If you don't, you can work on a lot of other things instead of just running to improve your running. And, as simple as like single leg balance symmetry, which we know is very important. So like you said, it's kind of the unknown of like, well, exactly how are people handling that impact duration better, and what all does that come down to? But I think we inherently know, because that's stuff we've been working on for decades, but now we're putting metrics behind. It's not just ground reaction forces or impact into the ground. It's, well, how well do you handle it? How's that change over time? All these metrics become more important, especially I'm sure at a higher level. That's where, a 1% difference could be a huge difference between, bronze and silver and gold, maybe.
Yeah.
What is a challenge that you've heard practitioners face when they actually now have data that maybe challenges some of the stuff that they thought? Have you guys ever run into that, where people are like, man, I thought this was going on, or I've been coaching people this way, and they're like, now I'm kind of seeing this, or this elucidated that? Anything that where it pulled back kind of the curtain on like, ooh, maybe the stuff I thought was happening isn't happening?
Yeah. I think it happens a lot because we have data that's objective and transparent, and like anything that requires that forces a bit of change or offers a new perspective. When we presented this, from a psychological perspective with new information, and there's a gap. Depends on how big that gap is between what you're taught, what you believe, and what the new information presents itself. If that information is like way too big, we know from the psychological theory is that we will be afraid of it, like afraid of the change, like no, or we'll say immediately reject it, say it can't be right. It's not what it's really stepping on my toes and what I believe. And some people, unfortunately, we do see that like that's the situation, and it's going to take a bit more time to peel away each layer of the onion. And some real re-education, new education for them to really understand, like, how do we bring this in, and how can we actually reshape our thinking and way of thinking about certain paradigms, like we're discussing today, whether it's symmetry, cadence, or impact. But we have the majority of people, therapists and clinicians, that are like, this is changing my view, but in a way that's it's bringing all the puzzle pieces together. It's more, the question is not like, okay, is this really, is this information good or bad? It's about how is it going to, adapt my clinical reasoning, and how can I do this now practically, that I don't start looking like not like a fool in front of my patients, but how can I use this in a way that I will get to the desired result, the key objective with my patients and athletes, now that we have this data at hand. And that's where there's a lot of exciting developments and bringing data into clinical reasoning, and that rapid experimentation that I was talking about a bit earlier is, finding the right cue that will work. Some people might not respond well to that, try land softer or change your cadence, but testing it out really quickly, really efficiently, and getting to that right cue. And of course, there are a lot of cues to try out. And on the one hand, you have a lot of things you can try. On the other hand, you only have so much time with your patient and athletes. Mm-hmm. So I think that's where the new exciting, the cutting edge technology is now coming in. More is how we can find those right cues as quickly as possible, using Run-Easy as a tool, and rather than pushing back when you get data that doesn't match your theory of mechanism of how this injury was happening, but rather to see it as another perspective and to reflect on it and find a new understanding of, what is this data meaning? Where is this coming from? What's causing these asymmetries or these impact changes?
Well, I was just trying to pull up a research article. I'm searching through Evernote, and of course, typing in gait brings up like 100 articles in there for me. But we know that we can change running gait, right? By, intervention, whether it's coaching cues. I just kind of have a curious question for myself, because you're obviously heavier on the assessment side, gathering data, but I'm sure that you've looked into plenty of the interventional side as well.
Yeah.
How much, or what's your quick thought on how we should approach changing gait? Because I've been on both sides of the fence of, man, walking gait in particular and running gait are very, they're happening for a reason as they're presented, right? These are things that your body is doing because this is the best manifestation of, neurologic output versus what the environment's giving that person on an input basis. But what's your thought on like coaching a runner versus like doing other things, right? Corrective exercises, improving ankle range of motion, things like that, to actually have a change in a gait, which I know there's both, but do you feel like we should lean heavier one way or the other? Or is it just N equals one, what somebody needs?
Yeah, and that's a fantastic question. And I think there's multiple strategies of achieving improvements in gait and getting those outcomes. I think up until now, we just haven't had the ability to really tap into corrective biofeedback gait retraining properly, because we haven't had the tools to do it on an objective basis. So I think there's a lot of potential there to bring it in more. But I, to a real certain extent, believe that, if it ain't broken, don't try to fix it. Like that, the kind of analogy, like, don't try to change your running gait if you don't have a problem. But what we also see is, like, you don't know if there's a problem unless you've kind of made an assessment. Even if there's no injury present, there could be a previous injury that's a compensation, and those compensations patterns that we don't always see with the naked eye that are lingering and are, creeping up on the athletes or the patients. So I think it comes down to identifying, is there a compensation pattern present? And is that compensation pattern, is that going to be a driver in an injury in the coming weeks or months? And if we can identify whether that is the case, if it really is a compensatory pattern, I think we want to be correcting the compensatory pattern rather than just fixing or changing a global running gait for a certain reason. Using a certain cue. I think the cue should only come if we really identify a specific compensatory pattern that we think, get this is going to play a role in an injury in the future, or is playing a role now as the athlete comes back from an injury. And how do we assist that athlete, whether it's to offload or whether it's to improve the stability of the runner, or improve the symmetry gradually. I think to a certain extent you need to find a compensatory pattern before just going straight into it, but always combining it with that the exercise therapy and proprioceptive and neuromuscular control, and not neglecting what we know works, but to add a new puzzle piece, a new tool in the tool set, because now we can identify, assess whether there's a compensatory pattern, and see whether certain cues can help fix that.
But I guess you could approach it both ways with a tool like this. Of one, you use these as your objective measure, or you check your work with this, right? So it's kind of, well, you may still go do stuff in the clinic, and that's the way that you approach it, and then you can check it, or you're literally using these parameters on the fly with coaching and cueing and seeing what's changing there, or a little bit of both based on what's going on. But I think you kind of you touched on the question that every coach or therapist in the world really has a hard time answering, is when do you intervene, right? Like, we don't have an injury, or there's no pain, right? I guess those are two different things, reposition of pain, and you can still have tissue pathology. We all know that. But like, when do you intervene? And I always bring up, if you're familiar with the Kenyan Priska Jeptu, she's like the queen of what we would say is like terrible mechanics, just from a visual standpoint, right? Massive valgus load and all these things, but she's won New York, Paris, Turin, London. She won all these marathons. Until she got busted for PEDs, was pretty injury free. But you look at somebody, just looking, again, we don't have parameters, and we've talked about that already. When do you intervene? This is the question that's tough, but at least, now we're having the conversation around objective data measures that are from large, aggregations of runners. And then, I guess you still have to make the call on a personal basis of like, do you change things? Because like you said, you'll see people outside of that 10% symmetry differential that do just fine, or that's ideal for them. And I mean, that's where you have to take all three legs of the tripod of treatment, right? Evidence, personal experience, and then, basically the person in front of you, and kind of say, well, yeah, that's what I'm doing. But that's a tough question to answer for anybody.
Yeah, and you have to have all three pillars of evidence-based practice, and I personally believe that you don't just having objective gait analysis. It should not be the one priority. It's just got to be included in the loop, and included in the feedback loop, and used as a quick way to get another dimension that we previously didn't have, and help steer and guide that clinical reasoning process on an individual level, as what we strive for.
Yeah, because I'm sure, like you said, it is another piece of the puzzle, but you don't want to open up Pandora's box on just, hey, to like make all these perfect. Like, that's not the goal either, because you have to take everything into account, right? Well, again, you and I can talk about all the nerdy running stuff for literally hours, and some of this stuff has no, black or white answer. It's very much, you get data, you see what changes, and you got to make a decision as a coach or therapist or a researcher at the end of the day. In terms of what's coming up, you guys have. Well, first of all, let's talk a little bit about something that maybe goes outside of distance running or running in general, which can be the acceleration, deceleration data that you guys are starting to look at more and more. Why are you guys looking at that? First of all, why is this important, whether it's for a runner or other athletes?
Well, what we see is that the ability to decelerate, especially, is really really important for lots of athletes. You're looking at football players, hockey players, basketball players. The ability to decelerate after an acceleration in a way that's coordinated, in a way that has distributed loads, in a way that prepares you for that next step. And it's becoming, it's a critical evaluation criteria. And there's some amazing research that's coming up now that's, from Damien Harper and his colleagues, that is really showing how important it is that you have the biomechanical ability and capacity and coordination to decelerate properly. And it's been a massively overlooked component of the return to play component of athlete rehabilitation and getting them back on the pitch and knowing when they're ready. We often it's been used as like the Biodex, the isokinetic forces, and we know that's not a functional way of testing, but it's because it's called standard, and we know that we have measures of strength. We know that it doesn't include the neuromuscular and coordination aspects and the dynamic aspect, and so we see a huge opportunity through our wearable technology, and it's what we've been developing in the last couple of months with Dr. Bart Dingen in Belgium, he specializes in ACL rehabilitation, of cruciate ligaments. And we've co-developed an algorithm that gets the biomechanics of each step and how you accelerate and decelerate. And the compensation strategies that we're identifying are really, really interesting, specifically the ones that are offloading, they're not breaking on the injured limb, the side where they had that ACL reconstruction. And we can use that now as more objective criteria in that final phase when you say, okay, is my athlete ready to go into explosive change of directions? I think it's a really exciting new direction we're evolving our product.
No pun intended, right? Different direction. Yeah, I mean,
Exactly.
we were talking about this a little bit before that. I was listening to a podcast between Dr. Brett Winchester and Brad Scott, who's the head of performance for the Atlanta Braves, and he was saying that one of the biggest things they look for in terms of players coming back into spring training from an injury prevention standpoint is decel acceleration work because of the prevalence of hamstring injuries with base running. And he said that's the thing that's going to take most people out during the season. So they're more concerned about acceleration, deceleration, instead of just straight out like how much you've been running, because like you could go run and like you said, there's a lot of components there. So I think that's very cool. And then again, another objective measure for return to play just in general, if you're in the clinical setting, as those parameters become more prevalent and used with Runeasy. I mean, it's, one thing to do, box step down tests and single leg hops and all these things, but like, getting another objective measure should make you feel safe, because I'll speak from personal experience. There's somebody coming back, like I've had a couple MPFL surgeries, people that had partial tears and ended up with full tears. And it's like, the better you can get your RTP criteria, at least the better you sleep at night. So if something does happen, you're like, well, stuff happens, right? But at least you're like, I had all of these parameters that they actually passed. And, because I've had injuries where like, man, did I test everything out adequately? Like, how could I have done something better? So I think if you get more concrete there, just kind of puts your conscience at ease a little bit, for sure.
Yeah, for sure. And I mean, if you think about it, if you wanted to get this kind of information or objective measures, traditionally you would need to line up, I don't know how many force plates. I mean, we measuring the forces for every step in that accel decel, and you would need a whole highway of force plates to be able to get each step. And we see that with every single step in acceleration and deceleration has a completely different functional role. Each one is either preparing for deceleration or is now the planted leg at the end, and either how many steps you use to decelerate, the timing between it. There's so many different strategies that are going to help you either be more efficient at sidestepping afterwards, or be prepared for that situation when you have a defender. And so you need to be able to measure every single step. And if you only have one step, one force plate, you're missing so much of the picture. You got one little snapshot, and everything else is ignored. And the profiles that we'll be able to develop now or create for each step, left and right, and how the forces evolve, and the curves of and how we decelerate, it really sheds some interesting light on how each player is protecting or is now has the ability to decelerate efficiently and properly. Yeah, it just adds another puzzle piece in the RTP criteria, and I think that's where we want to start moving towards is what would be good RTP criteria using this data for certain types of injuries coming back to play and to peak performance.
Well, and I mean, I find myself telling people all the time, that's the bulk of hamstring injuries, patellar tendinopathy, all these things are coming from the inability to decelerate in an efficient manner, or just one, bout of hard deceleration that's not, maybe it's under duress or fatigue or poor neuromuscular coordination, and see a biceps femoris sprain or something like that. But so yeah, it'll be interesting for me to play around with that as that becomes a little more polished within the technology. Is there anything else that you guys have coming up? I think you mentioned that you guys have possibly this remote monitoring system where we'll be able to do a little more out of clinic work.
Yeah, indeed. So what we'd like to improve is the ability to, like have that full kind of, you could say like biomechanical passport of your athletes, and not just when you see them in your clinic or when you meet up with them on the track, but to see the evolution from run to run, and be able to give them feedback completely remotely when a red flag is detected, a compensatory pattern is detected, that you can give them a consultation virtually from anywhere in the world. And that's a technology we're looking forward to developing as well, is that ability that your clients, your athletes can come in, we can give them a Run Easy system to use for a couple of weeks, so that you can make sure you don't miss a single step virtually from the training, and getting a much more bigger picture and detailed view on the natural training environment. And if they have a particular injury, say it be patellofemoral pain syndrome, one risk factor we often know is that downhill running triggers that pain and the injury, and then being able to link an environmental risk factor by looking at the data and saying, we see that only when you're hitting the downhills, you have that huge, high impact load on that knee or that side. And we can now have actionable information. We can do actionable things about that, modify the training program because we have information from where you're actually training. And that's where you can kind of intervene in a early onset kind of way, detecting those red flags in a smart way before the problem really escalates and snowballs.
Well, and I'm seeing this again, being in the trail running world. I mean, so many, patellar tendinopathy issues with downhill, and it gets to the point where, that's what takes people out of a race. And some of that is the sport. I mean, it's not the most natural thing in the world to run 100 miles on a clip, but if we can shore up some things throughout training that become, chronic issues, then you can help people, accomplish their goals. So that's something we're going to be doing, is putting Run Easy monitors on people that are actually in race scenarios, and just kind of seeing, when they're not, they should be well rested, tapered, in ideal world, best shape of their training, and then go see what happens from a mechanical standpoint during that race. I think it'll be really cool for me to see that. But yeah, I think we tackled a lot. Hopefully we answered more questions. Well, no, I'll take that back. Hopefully we created more questions for clinicians and coaches than we answer, because that's actually what we should be doing, whether it's research or through technology, not, giving people answers. So hopefully we did that, made people think a little bit differently about maybe some of the dogmas surrounding, running gait analysis, things like that. Any last words for us about, Run Easy, what's coming, anything like that?
Yeah, I'll just maybe go back to that running quality score and say that we're really, really excited about this. Twofold. Well, firstly, it summarizes information, all the metrics into one score. So you have an ability to really know, is the improvement happening in an overall, in a very quick way? And secondly, a way to, sometimes we have, biomechanics especially can be very complicated to the athlete or the patient, and trying to explain and disseminate a whole biomechanical mechanism into, what is really going on and what can we do about it can be very, very difficult for a lot of clinicians. And what we believe we have now is ability to kind of have a great visualization tool that's appealing to the end user, to the runner, to the patient, so that they can learn and you can actually educate them, so that they understand what's happening and they know more about their bodies and how it functions in a dynamic way and what happens when they run. And that's what we're really excited about bringing out this Runeasy running quality score, is to be able to identify those weak links and to help the communication between patient and practitioner.
Perfect. Well, I've liked or enjoyed using the product so far, and it's been great, learning from you over the past couple of months, and in particular today. So thanks again for coming on the show. Thanks for putting out great tech and continuing to kind of push into the profession a little bit further. And for anybody that's interested in learning more about the Runeasy tech, I'll put links to the website. You can find them on social media. And then, I just thank you again. And I'm excited to see what Runeasy's got coming in the future and how it's going to help my practice and other people's practices like me.
Great. Thank you so much for your time, Bo. It's been fantastic chatting to you. And these are passionate topics about, and it's great to push the envelope a bit on bringing tech into practice and bridging that gap.
Awesome. Well, thanks again, man.
Thanks so much.
Yo.